Joining us now to discuss the rise of RSV cases in America and the White House response is Dr. Peter Chin Hong, Professor of Medicine and Infectious Disease Specialist at the University of California in San Francisco. Thank you very much for your time, Dr. Hong. Now, it's been described as the worst paediatric care crisis in decades. How concerned should people be?
I think we should be very concerned, Sally, because pediatric hospitals just don't have a lot of capacity, period. There are a lot more beds in adult hospitals, so for many pediatricians, this is their March 2020.
How do you strike the right balance between raising awareness among caregivers and managing fears that may morph into over-concern?
Well, I think, I think the primary stop or the primary step is to really try to reduce transmission as much as possible. But you're right, Sally, you don't want to make people feel panicked. But there are very simple things that people can do. What might be a cold in an older sibling or an adult may be more dangerous in the very old, above 65, and the very young, under 2 years old.
It's come at quite a confusing time, especially off the back of a COVID-19 pandemic, where perhaps a lot of parents assume that their children are resilient to RSV, a little bit like they were to COVID compared to the more vulnerable elderly populations. Why is this different? Why are children more sort of vulnerable and susceptible to these particular viruses at this point?
So there are several common features with the other viruses like influenza, and that includes, of course, not having a lot of population immunity for the last 2 years. So when it comes now, a lot of people just haven't seen it for a while, particularly the younger kids. The second reason, of course, is that people are moving around now more, but they're not only just moving around locally, they're moving around in larger distances through travel, and that brings risk from one area to another. The third reason, of course, is that it's colder and people are gathering indoors. At the end of the day, the reason why very small kids are at risk is because their airways are so small. When they get a lot of secretions, it may make it very difficult for them to breathe. So it's not a big killer in the under 2-year-old group. It's actually a bigger killer in over 65. But for that age group, they need a lot of respiratory support. They may need rehydration because they may not feed as well.
Now, under the obvious surface level issue that we're talking about here is the underbelly of a chronic problem within hospitals. Doctors say that paediatric hospitals and wards are chronically understaffed. What's behind the mass exodus in health workers, and what can be done to woo them back?
Yes, so there have been hundreds of thousands of healthcare workers who have either resigned already or intend to resign within the next year or so. And a lot of this is just two things. The first is, of course, the chronic overworking that people have had and were saddled with in terms of responsibilities, not in terms of only direct patient care, but when your colleagues are ill, you have to come back to work and cover them. The second, of course, is this phenomenon called moral injury. You're taking care of people and you're taking care of sick people when they didn't have to be sick because they didn't believe in vaccines, or they believe in vaccine conspiracy theories, or you are actually assaulted verbally or physically because of your beliefs in science.